you diagnose menopause? Menopause is a state of a low estrogen production but a high production of the gonadotropins, which include FSH and LH. Between the two, we depend on FSH. FSH more than 40 is considered to be diagnostic in case of the menopause. Positive pregnancy test and she is bipolar. So what is the drug of choice? There are different interpretations of this question actually. Was it given what was the drug she was already taking? She was already taking lithium, blah blah blah, was not there. Oh, only examiner is interested to know safe drug in, right? If you say safe drug, that would be antipsychotic, which is typical, which is haloperidol. But if she is already on lithium and recently diagnosed with pregnancy, the very important rule is the very news that she became pregnant is not a reason to abruptly stop lithium. She is already in acute maniac episode, right? What was that? Clonazepam. Valproate is not there. Okay, I too don't want it to be there. Haloperidol was there, right? So haloperidol is considered to be the safe, pregnancy safe. There are two ways of handling mania. One way is you give a mood stabilizer or you give an antipsychotic. Among antipsychotics you can give atypical or typical. Atypical are teratogenic in pregnancy, but typical are not teratogenic in pregnancy. There is a reason you can always give haloperidol. But she was earlier not on haloperidol. If she were to be on lithium earlier, then the rule is don't suddenly jump from lithium to haloperidol. I leave to your brevity what the examiner wanted. So, but definitely you need to review in psychiatry management of bipolar disorder in pregnancy, management of psychosis in pregnancy, management of depression in pregnancy. There are the three things. Definitely one clinical scenario will be asked in next exam. Actually speaking, lamotrigine is considered to be excellent drug that can be given safely in pregnancy, right? So that's another important point. Then what is modified biophysical profile? Was it given? What is your answer? Huh? NSTN? Yeah. Postcoital contraception. Fourth option is what? Okay. In this the fourth option. Okay. So now let us debate on that. IUD is given, levonorgestrel is given. Desogestrel also belong to the group of progesterone only pill. But the literature says it has not yet been evaluated for emergency contraception. In emergency contraception protocols, if you read UGPACE regime, blah blah blah, you have got LNG and IUD, copper containing IUD. But desogestrel is not mentioned anywhere. So it is also a progesterone, right? Like levonorgestrel. So that is the reason probably we can figure it out on desogestrel as a possible answer. No doctor. Swyer syndrome. पहला Swyer syndrome क्या है मालूम होना. कितने लोग को Swyer syndrome मालूम नहीं है? Honestly raise the hand. Good. Thanks for the honesty. I too didn't know until today. अरे बीच में टर्नर मालूम है, क्लाइनफेल्टर मालूम है, और 15 साल से हम यही काम पे है, मगर Swyer क्या है हमको भी मालूम नहीं था. Swyer is called primary gonadal dysgenesis. Primary pure gonadal dysgenesis. If it is pure, then what is impure? Turner syndrome is called only primary gonadal dysgenesis, but true primary gonadal dysgenesis is the name given for Swyer. Kyun diya? Why is the name? If the genotype is XY and gonadal dysgenesis is there, then that is called as Swyer. If the genotype is not XX or XY but XO or any other aneuploidy and gonadal dysgenesis is there, that is only called gonadal dysgenesis. समझ में है ना? तो Swyer में XY genotype will be there, right? But external genitalia will be like a female. If your tissues, peripheral tissues can produce little estrogen, breast will develop and you will be treated as a female only, right? So there is a reason like testicular feminization syndrome. In that also testosterone converts into estrogen, estrogen lead to breast development and that lead to external genitalia look like female in testicular feminization syndrome. Right, doctor? So Swyer is an example of what? Gonadal dysgenesis with XY. And obviously they cannot produce a ovum. So somebody should donate them the ovum. But do they have a uterus? Yes. Because in our embryonic life, we are like Ardhanarishwar Parameshwar. There is a chance of developing both female and male genitalia. Only thing is our karyotype XY will make the which system, Mullerian or Wolffian? Mullerian system to suppress. Okay. So they still have uterus. That's the reason they don't need a surrogate pregnancy. But just they need a ovum. That is what is exactly done in case of Swyer syndrome. ये तो पूरा DM gynecology level वाला question है. Don't ask me what will they do in DM gynecology. MD gynecology 3 years only is too much for cutting uterus and know how to cut it without injuring ureter. DM level में क्या करने का होता है? Swyer syndrome का infertility management is DM. Then Levenor-Gestel. Premenstrual tension में why will you use Levenor-Gestel? Question बनाने में थोड़ा मसाला होना चाहिए. Then doctor, every time in our mock test we used to give one variable, one late deceleration pattern and image based questions we tuned you already. So examiner ultimately gave variable and that is cord compression. Variable cord compression, head compression is early deceleration and late deceleration is fetal hypoxia. How to recognize these three topographic patterns on image? You must learn. Then doctor, Asherman syndrome commonly presents as, how many thought it as oligomenorrhea? No. Amenorrhea was not there. Hypomenorrhea was there. Hypomenorrhea is there. Oligo was also there. Menorrhagia, what was there instead of amenorrhea? Metrorrhagia was there, intermenstrual. Dysmenorrhea was there. Dysmenorrhea. Hey, really? Okay. Even if it is there, no tension. Most common manifestation is amenorrhea 37%, hypomenorrhea was 31%. What our online students are saying, oligo and hypo are given, metro is there, but amino was not there. Chalo. Amino was not there, then hypo become the most common. Okay. When will you give anti-D prophylaxis? Routine question. 28 weeks, hundreds of times this was asked. What is the treatment for PAH? Alpha methyl dopa. Nowadays labetalol is becoming superior, but I don't know what examiner's question bank answer was. Safe is methyl dopa. Safe for pregnant women, safe for you. Then what is the, this is a sickening question. Misoprostol dosage for postpartum hemorrhage. Yeah, I mean, we are supposed to be ideal doctors as house surgeons. We are supposed to go to villages and treat PPH, no? 800 was there, but 600 was the recommended. इसलिए मैंने 600 बनाया उसको. 600 was also there. Then 600 become answer. Because WHO has recommended 10 international units of oxytocin or 600 micrograms of misoprostol administered orally. is considered to be the recommendation of WHO. Okay, 600 become benchmark. Can you go to the next PPT? Puppy is saying 600 is for prophylactic, 800 is for therapeutic. I don't know, but this is a confirmed literature which I am giving. We will upload all these explanations and questions into newsformedico.com as a blog. You can get it on smartphone. Don't waste papers and all that. Isliye we didn't give you the Xerox copy, print out, blah 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 and all that. And also we will host this discussion video on YouTube. Ask your friends to have a free ride on youtube.com/onlinembbs. Now doctor, Beck's cognitive triad of depression. What is your answer? Guilt is not there. What is Beck's cognitive triad? The self, the future, the world. Three things, doctor, in the depressed person's life. I am ugly, I am worthless, I am a failure, I don't get it. What is that called? Self. I am hopeless because things will always be this way only. I will prepare that misoprostol is for PPH. It is not for fibroid shrinking. And examiner will ask dosage. Right? So, the future. Because my fear is PGI में किसका dosage पूछेगा, state entrance में क्या पूछेगा, then the world, no one loves me. So three things are involved in Beck's triad. What did he say? The Beck triad? The self which is worthless, world which is unfair, future which is hopeless. If you are getting all the three feelings, we will give free coaching. That's called corporate social responsibility. Right? All the three feelings if you are getting, all three should come. So, but don't get those feelings about us that we are worthless coaching. We give very unfair questions in mock test and bring down your confidence, and future is hopeless. Pervasive developmental disorder. What is a wrong statement? There is a qualitative defect of social interaction, stereotypical repetitive movement, वो तो confirmed है. But reservation against cancellation में cognition attention है. ये दोनों दिया क्या? Attention cognition was given. If you take autism, if you look at the pervasive disorders, autism, Rett syndrome, childhood disintegrative, Asperger and POD otherwise specified. PDD otherwise specified. That's how you subclassify. Among this, which is the one which is seen only in girls? Rett syndrome. Social interaction, communication, repetitive behavior are the triad of the features. But communication comes under, communication is not given. Cognition and attention was given. That's what I am not sure what examiner want. Attention was not there in the options. Communication was there. Then we will make cognition, because all childhood disintegrative disorders do not carry a cognitive deficit. That is an important role. There can be autistic children with very good cognition. Cognition means learning. There may be autistic children who have a impaired cognition. Both the things are possible. Now doctor. But anyway, this is a standard topic in psychiatry. What are the 10 topics in psychiatry? उंगलियों में बोल सकते. Schizophrenia, mania, depression, alcohol like substance abuse, autism like disorders. One question on antipsychotics and antidepressants. Like that you can उंगलियों पे calculate कर सकते. Not more than 10 hours you should read psychiatry unless personally you require. Then what is the chest X-ray? Hydropneumothorax. What is this lateral spine means? Scottish Terrier dog sign. It looks like the neck of the Scottish Terrier dog, and in India we don't see regular dogs, only how they look like. स्कॉटलैंड जाके स्कॉटिश टेरियर किसको मालूम है? So that is slipping of one vertebra or other leading to the pars intra-articularis which is being broken, which is called as Scottish terrier sign on the lateral spine x-ray in spondylolisthesis. नीचे जो होता है गलीस, ऊपर जो होता है माउंटेन. Montagia is upper, Galizia is lower, Coley Smith. So if you ask any student who wrote AIIMS, whatever he answered he will imagine in the radiograph. No, who said that Galizia ji was given? It was Coley which is given. Another fellow will say no, Coley कहाँ है? वो तो dorsal displacement है, ventral दिया इसलिए वो Smith है. But anyway, you must there are two options. You fit your knowledge into patient or you fit patient into your knowledge. One of the two. Now doctors, hip flexion test. Was it an image based question? Oh, last before week only we gave a same question in our mock test. No big deal. So what is meant by Thomas test? You will ask the person to flex his knee. This side leg में if there is a flexion deformity, if you flex that side, it will rise above the floor. That raising of this entire thing above the floor when you flex the other knee joint is called as Thomas test. Right? So it's called fixed flexion deformity test of Thomas is what you need to basically remember. एक gun stock or a cubitus valgus. Without that there is no paper. So tardy ulnar nerve palsy, cubitus valgus, where do you find lateral condylar? Fracture of humerus. अगर lateral condyle को fracture हो गए तो medial condyle continue to grow and it will typically lead to cubitus valgus. Varus you will get it if you get a supracondylar fracture is what you need to remember. What is एक कलर के बिना पेपर होता क्या? एक सिलेंडर का कलर, पेस्ट बास्केट का कलर, एक कलर तो होना. So black body, white shoulder is oxygen cylinder. Minimum doctor this is. If you are a house surgeon, gone to hospital, you will answer it. So all cylinders, colors, be ready. Now in a pregnant female who is in shock, what is best? 5 things about ketamine, doctor. If you don't know the 5 things, ketamine is the king in those 5 things. I'll tell you what are they. It is the best thing if the patient has a shock. It is the best thing if the patient has an asthma. It is the best thing in the children who have congenital heart disease. It is the best thing whenever you need to do the burn dressing changes, you want some analgesic activity. And it is the best thing whenever you have got a very low supply of oxygen equipment, you are in the middle of a catastrophe or a trauma, big trauma, that time you need to do in the war field. Battlefield anesthetic is the name given for ketamine. Okay. Where do you put laryngeal mask airway? Laryngeal mask airway is called supraglottic airway. What is the glottis? Vocal cords. Vocal cords के ऊपर होए तो उसको क्या बोलते हैं? Laryngeal mask airway. So it should be above vocal cords. Is it an image based question? Where is the tip lying? Above the vocal cords भी दिया? नहीं वो tip only instrument was given. Where will you put the tip? He was asking. It is like Chandamama Balamitra puzzles, right? So you have got a this thing. The tip should be kept above vocal cords. Yes. So I leave the literature for you. Now, one life cycle of Japanese encephalitis was given, right? Then farmer multiple discharging sinuses. Did they give discharging sinuses farmer also? इसके बाद आपको इमेज का जरूरत क्या है? Discharging sinuses multiple is equal to spina bifida. I mean chorda equina. What will it tell? Actinomyces. Actinomyces it will tell, like Avatar. Huh? Was it not there? Huh? He asked the stain. What was the stain given? AFB was given. No, he asked organ. Did he give histopathology or not? He gave the histopathology. He asked what organism and what stain. Okay. Multiple discharges, actinomycosis. Let us not worry much. Huh? But what is the carry home message? Image based questions में image को देखो मत. अगर image को देखे तो आप सोचना शुरू करेगा. सोचना entrance hall में अच्छा नहीं है. It's a very bad habit. If you are thinking and answering, you are definitely answering wrong. That is the rule, Murphy's law of getting into top 100 ranks in the PG entrance. Reflexly you are answering. Oh, at a deep tendon reflex level, if your supinator is working, pronator is working, and you are ticking, that is the day you can count. You are going to get the seat. Huh? So generally images are very, very. History is the thumb, doctor. Even in clinical practice, you should get that intuition about treating. Oh, one deformity was given. What is this called? Was asked. We had the same question in one of our mock tests very recently. Huh? So I don't know. ECG अगर दिए तो अगर आपको MI नहीं दिखाए तो most likely probability of ECG क्या होता? Electrolyte disturbance होता. Either hyper, hypo, calcemia, kalemia, magnesemia. Right? All those look at QT interval, lengthening or shortening. QT interval more than 600 milliseconds is called lengthening. एक बड़ा डिब्बा कितने milliseconds होता है? One small dibba is 40 milliseconds. 5 small dibbas make a bada dibba. So bada dibba होता है 200 milliseconds. 600 milliseconds means more than 3 boxes if the length is there. QT interval. That's called long QT. So how will you calculate QT interval from the beginning of the QRS to the end of the T wave? You should look at the number of large boxes. So any prolongation of the QT is a risk factor for using. Sotalol was there? Huh? What is not used, right? Huh? Maybe one of the drugs which predisposes to versus the long QT syndrome. One of those antiarrhythmics must be among the options like sotalol. Huh? Now doctor, newborn with the swelling on the back, meningocele, liver में red and pale areas. What are red areas? Congested areas with RBCs are red. Pale are the normal areas of the liver. That is called nutmeg liver, right? Then what is the needle? LP needle was there, right? One more question on bone marrow biopsy needle was also there. I thought options are mixed. No. तो एक needle वाला next में regular suturing needle आएगा, Karun needle, etc. etc. Then doctor, crystals, envelope shaped are always calcium, oxalate. Yeah. Then KMS sinus was given, and what is that which is staying inside? Abducent nerve. Recognition of abducent nerve. Then capnography में there was a question which is Curer dip. Whenever Curer dip is there on capnography, what is the important thing? That means that the neuromuscular blockade is getting veered off. So you need to give one more push of neuromuscular blocking agent. That is how on capnography Curer dip basically indicates. The name itself is Curer, no doctor. Suppose if looking at this dip you are thinking of aortic notch and all that, and you didn't know that this is called as Curer capnography. Completely if you are out of the game, no one can recognize. ECG में one atrial fibrillation was given. Was it given? One AFib was given. At least one AFib, VFib, broad complex QRS means VT, narrow complex QRS means SVT, slurring of the upstroke of the QRS with the short PR interval, delta wave, Wolf Parkinson White, 20 ECGs. Every mock test we had been routinely giving these image based questions on ECG. Without ECG no paper, right? So you have to be sure. One SVT was it given? PSVT was given. PSVT is also SVT. So how do you manage? Adenosine was given in the options. Yeah. PS. All except was there. Okay. Then which vector? Was it given the vector image? Very difficult. How will you recognize mosquitoes looking at their, anything is a mosquito for us. Sometimes while doing MD I came to know difference between housefly and mosquito in the duty room. Whether the one which is very thick, is it a hypertrophied mosquito or a this thing. When you do in a government hospital duty, you have a lot of companions. Oh, sandfly and leishman. At least there are only 5 mosquitoes. Just review them. Once more, which mosquito will be lying with vertical, inclined across vertical, which will be laying eggs under surface, laying eggs like rose, which will spend honeymoon in Goa. All these things you must be ready. Entomology experts when you go for exam. One image based question will come. So this lesion of soapable appearance of giant cell tumor was there. Then laparoscopy, a cystadenoma. Uterus and ovarian cystic lesion was given. Bilateral was there. So Krukenberg you answered. And ovary was retaining the shape of ovary. That is the criteria to call Krukenberg. In Krukenberg there are metastases to the ovary, but ovary retains the shape of the ovary. That is the hallmark. Which part there is an arrest? One arrest diagram was there, no? I'll come to that arrest wala question. Meanwhile, what was given? Gametocyte was given or all the gametocyte, trophocyte, all are given, and do you know Chatterjee was among the options, right? Who will read parasitology and microbiology, doctor? Don't tell me you read. 5 topics: streptococci, staphylococci, corynebacterium, diphtheria, anthrax, typhoid, finish bacteriology. Virology, what is there? DNA viruses, RNA viruses, classification, ho gaya. Gram positive, gram negative cocci differences. Cell wall, anyway, in intermediate we studied a lot about cell wall. But that's our entire basic microbiology preparation package in MBBS, right? So I think examiner want to know that banana shaped gametocytes are falciparum. I don't know what was the exact picture. Okay. Respiratory distress after hours, newborn baby, ground glass appearance, not responding to steroids, and similar problem was there earlier. That is an important clue. That points the diagnosis towards pulmonary alveolar proteinosis because of the earlier kid dying and not responding to steroid. So if you look at the typical histopathological picture of alveolar proteinosis, there is a collection and there is a ground glass appearance whenever you take the cut section. That's the point. But one thing I want to tell you, hyaline membrane disease, meconium aspiration, transient tachypnea of newborn, and a alveolar proteinosis, and neonatal septicemia and pneumonia. 5 things, how will you differentiate? Preterm mein which will occur, term baby mein which will occur, those delivered with cesarean section which will occur. This 5 you have to catch hold. Next sentence you are going to have it. First evidence of puberty is Lakh. 8 to 10 watery stools along with zinc, ORS and probiotics, are they prescribed by WHO or are we prescribing them? I am not sure. I need to check about the World Health Organization prescription. Then this was a very old question previously asked. 2-year-old boy came with a barking cough. Barking cough becomes cru. Whenever cru is there, laryngo, tracheo, bronchitis. What is the most important part of the treatment? Single dose dexamethasone is the one which you need to basically administer. Then severe acute malnutrition bolne ke liye, what are the criteria? Pitting edema, weight for height, mid upper arm circumference, but height for age is not. It is not for acute, but it is for chronic. Stunting, height for age. Our student Missy Kumar has sent a lot of questions we discussed is courtesy of our student from Guntur Medical College, and 70-140. What is ejection fraction? How much came, how much pumped, how much left? Right. So 70-140. So 70 by 140 become 50% is the ejection fraction. Then one Dale's media wala question was given. If you add epinephrine, there is a shortening. What is that Dale phenomena? Because of earlier exams, Dale phenomena due to what means you are answering epinephrine. Finish. You are passing to the visa counter. But now ek diagram drama jada rehta. Then that is the story. Last 3 more questions are there before we call it a day. So what do you say, doctor? Is AIIMS achievable? Are you sure? Yeah. AIIMS is achievable, but the hard part of the story is, if there are 30 seats, only 30 people can sit. There is no provision of bringing our own seats. So that is the truth, whether we love it or don't love it, right? In spite of the truth, the best bet is always state MD entrance for all the 5 states in South India. For across India, all India. Best bet means all India and DMB, they are the only exams. ये सब AIIMS, JIPMER, ये सब नौटंकी है. जाके एक एग्जाम लिख के आके जरा रो के you can finish one full spectrum of experiential process. Plotting of the weight. How many standard deviation we take to define malnutrition? 2 standard deviations. Then metabolic encephalopathy. Constructional apraxia was given and asterixis was also given. Both of them are basically the characteristic but non-specific features. Still asterixis stands as a possible answer. Actually both of them are possible answers if we review the literature. Histosalpingogram with a filling defect was given, no, that was a endometrial polyp was given. So that is the answer. Then cell cycle wala checkpoint question was given. So basically there are 3 checkpoints. How many checkpoints? Mitosis checkpoint, DNA synthesis checkpoint and cell growth checkpoint. So probably one of the things examiners specifically want to ask. When there is a massive bleeding, what should be the gauge of the intravenous cath? Bigger the number, smaller the gauge. Smaller the number, bigger the gauge. वो तो rule मालूम है, because we all as main duty as is to put IV line, right? Otherwise, you will not be, you will be treated dishonorable trash by your own nursing staff if you don't know how to put a IV line. Okay, so some will have the acumen, one shot they will go in. So now the question is, normally what is the cat size? 20 or 24? So 20 cat. Then all purpose pediatric line is 22. Whenever it is very urgent and large bore is required, then 14, 16 are large bore. So that is all the story, doctor. So there are another 25, 26 questions. But by the time already my eyes were aching in the morning 5 o'clock to complete, I will update it on the newsformedico.com blog, and it is achievable. Any entrance is achievable if you are strategic. So I wish to see you all in our mock tests, which we are going to have weekly twice from December, and until December we will have it on every Sunday, and subject test on Saturday. And every Monday and Wednesday we conduct the DNB review, and from December first week we will start APPG review. So good luck for preparation, and when you go to the exam, before you sit in the exam, already you should get that feel that I am going to win. This is my time of winning. It is not that you fearfully wait when is the result coming, and after the result comes, you are already prepared how to cry also. That should not happen. So thank you very much.